Question 1. A nurse is caring for a patient admitted with acute decompensated heart failure. Which assessment finding would indicate worsening cardiac output and require immediate intervention? A. Peripheral edema 1+ bilaterally. B. Weight gain of 1 kilogram over 24 hours. C. Crackles heard bilaterally in lung bases. D. Decreased level of consciousness and cool, clammy skin. Answer, D. Decreased level of consciousness and cool, clammy skin. This question tests your understanding of acute heart failure and the signs of significantly worsening cardiac output. The keywords worsening cardiac output and immediate intervention clue you into looking for signs of hypoperfusion to vital organs. Decreased level of consciousness and cool, clammy skin are critical indicators that the brain and peripheral tissues are not receiving adequate blood flow, signifying a severe decrease in cardiac output. While peripheral edema, weight gain, and crackles are signs of heart failure, they do not indicate immediate, life-threatening organ hypoperfusion as directly as neurological changes and poor perfusion. Remember, severe changes in mental status and skin perfusion signal a critical decline requiring prompt nursing action to prevent further organ damage. Question 2. A patient in the progressive care unit suddenly develops tachypnea, dyspnea, and pleuritic chest pain. The nurse notes tachycardia and a drop in oxygen saturation. What is the most likely medical emergency the nurse should suspect? A. Pneumonia. B. Acute exacerbation of asthma. C. Pulmonary embolism. D. Myocardial infarction. Answer, C. Pulmonary embolism. This question focuses on recognizing the classic signs and symptoms of a pulmonary embolism, PE, a critical respiratory emergency. The key phrases are suddenly develops tachypnea, dyspnea, and pleuritic chest pain, along with tachycardia and a drop in oxygen saturation. While pneumonia and asthma exacerbation could cause respiratory distress, the sudden onset and specific combination of pleuritic chest pain, pain with breathing, strongly point to a PE, which is often caused by a blood clot traveling to the lungs. Myocardial infarction primarily presents with cardiac symptoms, not typically pleuritic chest pain. Recognizing this constellation of symptoms is crucial for prompt diagnosis and treatment. Question 3. A patient with diabetic ketoacidosis, DKA, has a blood glucose of 550 mg per deciliter, pH of 7.20, and bicarbonate of 12 milliequivalent/L. The nurse anticipates an order to administer which type of insulin? A. NPH insulin subcutaneously. B. Regular insulin intravenously. C. Glargine insulin subcutaneously. D. Insulin aspart via insulin pump. Answer, B. Regular insulin intravenously. This question assesses your knowledge of managing diabetic ketoacidosis, a severe metabolic emergency. The critical information here is the patient's DKA diagnosis, indicated by high blood glucose, acidosis, low pH, and low bicarbonate. For DKA, the standard treatment is continuous intravenous, 4, infusion of regular insulin because it has a rapid onset and short duration of action, allowing for precise titration to gradually lower blood glucose and correct acidosis. Subcutaneous insulins, NPH, glargine, aspart, are not appropriate for the acute management of DKA due to their slower absorption and less predictable effects in critically ill patients. Always remember, in DKA, think 4 regular insulin for rapid and controlled glucose and ketone reduction. Question 4. The nurse is monitoring a patient's hemodynamic pressures and notes a pulmonary artery wedge pressure, PAWP, of 22 mm of mercury. Which condition does this finding most likely indicate? A. Hypovolemia. B. Right ventricular failure. C. Left ventricular failure. D. Systemic vasodilation. Answer: C. Left ventricular failure. This question tests your understanding of hemodynamic monitoring, specifically the significance of an elevated pulmonary artery wedge pressure, PAWP. A normal PAWP is typically 4 to 12 millimeters of mercury, so a reading of 22 millimeters of mercury is significantly elevated. The PAWP directly reflects left atrial pressure and, indirectly, left ventricular end diastolic pressure, which increases when the left ventricle fails to pump blood effectively, leading to backward flow and congestion in the pulmonary circulation. Hypovolemia would cause a low PAWP. Right ventricular failure would primarily elevate central venous pressure, CVP, and systemic vasodilation would decrease systemic vascular resistance, SVR, without directly elevating PAWP unless left ventricular function is also impaired. An elevated PAWP is a hallmark sign of left-sided heart failure and pulmonary congestion. Question 5. A patient on mechanical ventilation is becoming increasingly agitated and restless. The nurse notes an increase in peak inspiratory pressure and a decrease in exhaled tidal volume. What is the first action the nurse should take? A. Administer a sedative as prescribed. B. Auscultate lung sounds and assess airway patency. C. Increase the ventilator's respiratory rate. D. Call the respiratory therapist immediately. Answer: B. Auscultate lung sounds and assess airway patency. This question assesses your priority nursing actions when a ventilated patient shows signs of distress. The keywords first action are crucial, indicating the need for immediate assessment. Increased peak inspiratory pressure and decreased exhaled tidal volume, combined with agitation, suggest a problem with the airway or lung compliance. Before administering medication or calling for assistance, the nurse must quickly assess the patient for correct endotracheal tube placement, patency, and lung sounds to rule out easily correctable issues like kinking, secretions, or dislodgement, which could be causing the distress. Sedation might mask the underlying problem, and adjusting ventilator settings or calling a specialist comes after a thorough initial assessment. Always remember to assess first, then act or call for help. Question 6. The nurse is preparing to administer an intravenous push medication into a central venous access device, CV80. After flushing the line, the nurse encounters resistance and cannot aspirate blood. What is the most appropriate initial nursing intervention? A. Force the flush to clear the resistance. B. Remove the CVAD and insert a new one. C. Reposition the patient and have them cough or raise their arm. D. Notify the physician immediately for a declotting agent. Answer: C. Reposition the patient and have them cough or raise their arm. This question tests your troubleshooting skills for a central venous access device, CV80, when encountering resistance or inability to aspirate blood. The keyword initial is important, guiding you to the least invasive, first-line actions. Before escalating to medications or removal, simple maneuvers like repositioning the patient, e.g., changing arm position, head position, or having them cough/bear down, can often resolve a temporary occlusion or kinking of the catheter. Forcing a flush could damage the catheter or dislodge a clot, and immediate removal or declotting agents are typically reserved for persistent issues after simpler interventions have failed. Always try non-invasive positional changes first to attempt to restore patency. Question 7. A patient presents with sudden onset of severe headache, nuchal rigidity, photophobia, and a positive Brudzinski's sign. The nurse suspects which condition? A. Migraine headache. B. Ischemic stroke. C. Meningitis. D. Seizure disorder. Answer: C. Meningitis. This question assesses your ability to recognize the classic signs and symptoms of meningitis, a serious infection of the membranes surrounding the brain and spinal cord. The combination of sudden onset of severe headache, nuchal rigidity, stiff neck, photophobia, light sensitivity, and a positive Brudzinski's sign, flexion of the hips and knees in response to passive flexion of the neck, are hallmark indicators of meningeal irritation. While a migraine involves headache and photophobia, it typically lacks nuchal rigidity and positive Brudzinski's. An ischemic stroke presents with focal neurological deficits, and a seizure disorder has distinct motor or sensory manifestations. Recognizing these specific signs is crucial for early diagnosis and treatment of meningitis. Question 8. A patient is receiving continuous renal replacement therapy, CRRT. The nurse notices the effluent is bloody. What is the most appropriate initial nursing action? A. Increase the blood flow rate. B. Clamp the CRRT circuit immediately. C. Administer an anticoagulant. D. Assess the patient for signs of bleeding. Answer: D. Assess the patient for signs of bleeding. This question evaluates your understanding of CRRT complications and appropriate nursing interventions. The key information is effluent is bloody, which indicates a potential problem within the CRRT circuit or, more critically, patient bleeding. The most appropriate initial action is always to assess the patient first, checking for signs of active bleeding from the access site, other body orifices, or changes in vital signs that might indicate hemorrhage, because the bloody effluent could be coming from the patient. Increasing blood flow or clamping the circuit without assessment could worsen the situation, and administering anticoagulants might be contraindicated if the patient is already bleeding. Patient assessment is always the first priority in such a situation. Question 9. A patient is admitted with severe sepsis. The nurse monitors the patient for which of the following common complications of sepsis? A. Hyperglycemia. B. Syndrome of inappropriate antidiuretic hormone, SIAD. C. Disseminated intravascular coagulation, DIC. D. Hypokalemia. Answer: C. Disseminated intravascular coagulation, DIC. This question tests your knowledge of the severe complications associated with sepsis. Sepsis is a life-threatening organ dysfunction caused by a dysregulated host response to infection, and disseminated intravascular coagulation, DIC, is a grave and common complication. In DIC, the body's clotting system becomes overactivated, leading to widespread microvascular clotting and consumption of clotting factors, which paradoxically results in both thrombosis and bleeding. While other metabolic derangements can occur, DIC is a specific and severe hematological complication often seen in sepsis. Recognizing this specific complication helps the nurse anticipate and monitor for signs of both clotting and bleeding. Question 10. The nurse is preparing to administer a continuous infusion of norepinephrine to a patient in septic shock. What is the priority nursing intervention before initiating this medication? A. Obtain a 12-lead ECG. B. Insert a central venous catheter. C. Administer a bolus of intravenous fluids. D. Obtain arterial blood gases. Answer: B. Insert a central venous catheter. This question focuses on the safe administration of vasopressors, like norepinephrine, which are critical in septic shock. The key here is priority nursing intervention before initiating a potent vasoconstrictor. Norepinephrine is a vesicant, meaning it can cause severe tissue damage, including necrosis, if it extravasates, leaks out of the vein, into surrounding tissues. Therefore, it must be administered through a central venous catheter to ensure rapid dilution and minimize the risk of extravasation. While the other options might be necessary for overall patient management, securing central access is paramount before starting norepinephrine to ensure patient safety. Question 11. A patient with cirrhosis develops increasing abdominal girth, peripheral edema, and dyspnea. The nurse anticipates which procedure to relieve the patient's symptoms? A. Endoscopic variceal ligation. B. Transjugular intrahepatic portosystemic shunt, TIPS. C. Paracentesis. D. Liver biopsy. Answer, C. Paracentesis. This question assesses your understanding of complications of cirrhosis and their management. The key symptoms are increasing abdominal girth, ascites, peripheral edema, and dyspnea, which indicate significant fluid accumulation, particularly in the abdomen, impacting respiratory function. Paracentesis is the procedure to remove excess fluid from the peritoneal cavity, ascites, and is the most direct and effective intervention for symptomatic relief of fluid overload and associated dyspnea in this scenario. Endoscopic variceal ligation treats esophageal varices. TIPS is a more invasive procedure for portal hypertension, and a liver biopsy is for diagnosis, not acute symptom relief. Paracentesis provides immediate relief by draining the accumulated fluid. Question 12. The nurse is caring for a patient experiencing a grand mal seizure. What is the most appropriate nursing action during the seizure? A. Restrain the patient's extremities to prevent injury. B. Insert a tongue blade to protect the airway. C. Protect the patient's head and ensure a safe environment. D. Administer an oral antiepileptic medication. Answer, C. Protect the patient's head and ensure a safe environment. This question focuses on immediate and safe nursing interventions during a generalized tonic-clonic, grand mal, seizure. The most appropriate action is to protect the patient from injury, especially by cushioning their head and clearing the area of any objects they might strike. It is crucial not to restrain extremities, as this can cause musculoskeletal injuries. Inserting a tongue blade or anything into the mouth is contraindicated due to the risk of airway obstruction, tooth damage, or injury to the nurse. Oral medications cannot be safely administered during an active seizure. Your priority is always patient safety during the event. Question 13. A patient is admitted with a suspected CVA, stroke. The nurse understands that which diagnostic test is critical and must be performed immediately to determine the type of stroke? A. Magnetic resonance imaging, MRI. B. Electroencephalogram, EEG. C. Lumbar puncture. D. Non-contrast computed tomography, CT, scan of the head. Answer, D. Non-contrast computed tomography, CT, scan of the head. This question evaluates your knowledge of the immediate diagnostic priorities for a suspected stroke. The keyword immediately highlights the urgency. A non-contrast CT scan of the head is the critical first-line diagnostic test to differentiate between an ischemic stroke, blockage, and a hemorrhagic stroke, bleeding. This distinction is vital because the treatment, e.g., thrombolytics for ischemic versus no thrombolytics for hemorrhagic, differs drastically, and giving the wrong treatment can be devastating. MRI offers more detail but takes longer, EEG diagnoses seizure activity, and a lumbar puncture investigates infections, none of which are the immediate priority for stroke typing. Quick identification of stroke type guides appropriate and timely management. Question 14. A patient is experiencing ventricular tachycardia with a pulse. The nurse anticipates administering which medication? A. Atropine. B. Adenosine. C. Amiodarone. D. Epinephrine. Answer: C. Amiodarone. This question tests your knowledge of advanced cardiac life support, ACLS, algorithms for specific arrhythmias. The key here is ventricular tachycardia with a pulse, indicating the patient is stable enough to receive antiarrhythmic medication. Amiodarone is the antiarrhythmic of choice for stable ventricular tachycardia. Atropine is used for symptomatic bradycardia, adenosine for supraventricular tachycardia, SVT, and epinephrine for pulseless rhythms or profound bradycardia. Knowing the correct medication for the specific rhythm ensures effective and safe treatment. Question 15. The nurse is monitoring a patient post-cardiac catheterization. Which finding requires immediate notification of the physician? A. Mild oozing from the access site. B. Pedal pulses palpable 2+ bilaterally in the affected leg. C. Complaint of numbness and tingling in the affected leg. D. Patient reports feeling warm and flushed after contrast dye administration. Answer: C. Complaint of numbness and tingling in the affected leg. This question assesses your ability to recognize critical post-procedural complications, specifically after cardiac catheterization. The keyword immediate notification signals a serious and urgent issue. Numbness and tingling in the affected leg, the leg where the catheter was inserted, are signs of potential neurovascular compromise, possibly due to a hematoma compressing nerves or impaired arterial blood flow, which can lead to limb ischemia. Mild oozing is expected, palpable pedal pulses indicate good circulation, and warmth/flushing are common, transient reactions to contrast dye. Any change in sensation or circulation to the extremity distal to the access site demands immediate attention to prevent permanent damage. Question 16. A patient with acute pancreatitis reports severe abdominal pain. Besides administering prescribed analgesics, what is the most important non-pharmacological intervention for pain management? A. Encourage oral intake of clear liquids. B. Position the patient flat on their back. C. Maintain NPO status. D. Apply a warm compress to the abdomen. Answer: C. Maintain NPO status. This question focuses on essential nursing interventions for acute pancreatitis, particularly for pain management. The critical concept here is that severe abdominal pain in pancreatitis is often exacerbated by pancreatic enzyme release stimulated by food. Therefore, maintaining NPO, nil per OS, or nothing by mouth, status is the most important non-pharmacological intervention. This rests the pancreas, reduces enzyme secretion, and helps alleviate pain. Encouraging oral intake would worsen pain, positioning flat might increase discomfort, and while warm compresses can offer some comfort, they don't address the underlying cause of pain related to pancreatic stimulation. Resting the gut is paramount. Question 17. The nurse is caring for a patient who suffered a traumatic brain injury and has a Glasgow Coma Scale, GCS, score of 6. What is the priority nursing intervention for this patient? A. Administer osmotic diuretics to reduce intracranial pressure. B. Monitor for signs of deep vein thrombosis. C. Maintain a patent airway and provide ventilatory support. D. Implement seizure precautions. Answer: C. Maintain a patent airway and provide ventilatory support. This question assesses your prioritization of care for a patient with severe traumatic brain injury, TBI, based on their Glasgow Coma Scale, GCS, score. A GCS of 6 indicates severe neurological impairment and a high risk of airway compromise. The priority, following the ABCs, airway, breathing, circulation, is always to maintain a patent airway and provide ventilatory support, as an obstructed airway or inadequate breathing will lead to hypoxia, which can severely worsen brain injury. While other interventions like diuretics, DVT prevention, and seizure precautions are important, they are secondary to securing the airway in a patient with a profoundly decreased level of consciousness. Securing the airway is the foundation of care for the critically injured patient. Question 18. A nurse is assessing a patient receiving a continuous infusion of propofol for sedation. Which assessment finding indicates a potential complication and requires immediate intervention? A. Mild hypotension within expected parameters. B. Patient easily rousable to verbal stimuli. C. Elevated triglycerides and metabolic acidosis. D. Decreased respiratory rate within prescribed limits. Answer: C. Elevated triglycerides and metabolic acidosis. This question tests your awareness of a serious complication associated with propofol infusion, specifically propofol infusion syndrome, PRI. The keywords are potential complication and immediate intervention. PRI is a rare but life-threatening complication characterized by metabolic acidosis, rhabdomyolysis, hyperkalemia, elevated triglycerides, and acute kidney injury, particularly with high doses or prolonged infusions. While mild hypotension and a decreased respiratory rate are expected side effects of propofol that are managed, elevated triglycerides and metabolic acidosis are hallmark signs of PRI requiring immediate intervention. Always monitor triglyceride levels and signs of metabolic derangement in patients on continuous propofol. Question 19. A patient is receiving packed red blood cells. The nurse notes the patient develops sudden chills, fever, hypotension, and flank pain. What is the most appropriate initial nursing action? A. Slow the infusion rate and continue monitoring. B. Stop the transfusion immediately. C. Administer an antihistamine as ordered. D. Obtain a stat blood culture. Answer: B. Stop the transfusion immediately. This question assesses your immediate response to a severe blood transfusion reaction. The combination of sudden chills, fever, hypotension, and flank pain are classic signs of an acute hemolytic transfusion reaction, which is life-threatening. The most appropriate initial action is to immediately stop the transfusion to prevent further administration of incompatible blood. While subsequent actions will include notifying the physician, maintaining for access, and sending blood samples, stopping the transfusion is the critical first step to minimize harm. Never continue or slow the infusion if a severe reaction is suspected. Question 20. A patient presents to the progressive care unit with new-onset atrial fibrillation with rapid ventricular response, RVR. The patient is hypotensive and dizzy. What is the priority intervention? A. Administer oral metoprolol. B. Prepare for synchronized cardioversion. C. Administer 4-diltiazem. D. Initiate a heparin drip. Answer: B. Prepare for synchronized cardioversion. This question assesses your knowledge of managing unstable atrial fibrillation with RVR. The key indicators are new-onset atrial fibrillation with rapid ventricular response combined with hypotensive and dizzy, which signifies hemodynamic instability. In unstable atrial fibrillation with RVR, the priority intervention is immediate synchronized cardioversion to electrically reset the heart's rhythm and restore stable hemodynamics. Oral medications like metoprolol or 4-diltiazem are used for stable patients, and a heparin drip is for anticoagulation, which is important but not the immediate priority for instability. Hemodynamic instability necessitates immediate electrical intervention. Question 21. A patient with severe acute respiratory distress syndrome, ARDS, is mechanically ventilated. The nurse identifies which intervention as a priority for managing this patient? A. Maintaining a supine position to improve ventilation. B. Administering high tidal volumes to expand collapsed alveoli. C. Implementing prone positioning to improve oxygenation. D. Aggressively suctioning the airway every hour. Answer: C. Implementing prone positioning to improve oxygenation. This question focuses on best practices for managing patients with severe ARDS on mechanical ventilation. For ARDS, characterized by widespread inflammation and fluid in the lungs, conventional ventilation strategies can be harmful. Prone positioning, placing the patient on their stomach, is a critical intervention that improves oxygenation by redistributing ventilation and perfusion, recruiting collapsed alveoli, and reducing ventilator-induced lung injury. Maintaining a supine position, using high tidal volumes, or aggressive hourly suctioning are generally not recommended for ARDS and can worsen lung injury or increase complications. Prone positioning is a cornerstone of ARDS management. Question 22. The nurse is caring for a patient post-abdominal surgery. Which assessment finding would indicate the development of paralytic ileus? A. Hyperactive bowel sounds. B. Frequent, loose stools. C. Absent bowel sounds and abdominal distension. D. Passage of flatus. Answer: C. Absent bowel sounds and abdominal distension. This question tests your ability to recognize signs of paralytic ileus, a common complication after abdominal surgery. Paralytic ileus occurs when bowel motility is temporarily impaired, leading to a functional obstruction. The key findings are absent bowel sounds, or very diminished, and abdominal distension, as gas and fluid accumulate without forward movement. Hyperactive bowel sounds or frequent loose stools would indicate increased motility, and the passage of flatus suggests resolving ileus. Understanding that a silent and distended abdomen postoperatively points to a lack of peristalsis is crucial for early detection and intervention. Question 23. A patient is receiving continuous intravenous insulin for hyperglycemia. The nurse understands that frequent monitoring of which electrolyte is critical during this therapy? A. Sodium. B. Calcium. C. Potassium. D. Magnesium. Answer: C. Potassium. This question focuses on a crucial electrolyte imbalance that can occur during intravenous insulin therapy, particularly in conditions like diabetic ketoacidosis. When insulin is administered, it facilitates the movement of glucose and potassium from the extracellular space into the cells. This can lead to a significant and rapid drop in serum potassium levels, hypokalemia, which can cause life-threatening cardiac arrhythmias. Therefore, frequent monitoring of potassium is absolutely critical, and potassium replacement is often necessary even if initial levels appear normal. While other electrolytes are monitored, potassium has the most immediate and severe implications with insulin therapy. Question 24. A patient with a history of hypertension and diabetes presents with sudden, severe, tearing chest pain radiating to the back. Peripheral pulses are diminished in the left arm compared to the right. The nurse suspects which medical emergency? A. Unstable angina. B. Pericarditis. C. Aortic dissection. D. Pneumothorax. Answer: C. Aortic dissection. This question assesses your ability to recognize the classic, life-threatening symptoms of an aortic dissection. The combination of sudden, severe, tearing chest pain radiating to the back is highly indicative, and the additional finding of diminished peripheral pulses in the left arm compared to the right strongly suggests a compromised blood supply to an extremity due to the dissection affecting a branch of the aorta. Unstable angina typically presents with chest pain without such radiation or pulse deficits. Pericarditis causes pleuritic chest pain, and a pneumothorax causes sudden dyspnea and sharp chest pain. The unique pattern of pain and pulse deficit points directly to aortic dissection, demanding immediate intervention. Question 25. The nurse is providing education to a patient newly diagnosed with chronic obstructive pulmonary disease, COD, about oxygen therapy. The nurse emphasizes that excessive oxygen administration can be detrimental due to which physiological effect? A. Worsening of pulmonary hypertension. B. Suppression of the hypoxic drive to breathe. C. Increased risk of aspiration pneumonia. D. Development of metabolic alkalosis. Answer B. Suppression of the hypoxic drive to breathe. This question targets a critical principle of oxygen administration in patients with chronic obstructive pulmonary disease, COD. For many individuals with chronic hypercapnia, elevated CO2 levels, due to COPD, their respiratory drive is primarily stimulated by low oxygen levels, the hypoxic drive, rather than by high CO2 levels. Administering excessive oxygen can suppress this drive, leading to hypoventilation, worsening hypercapnia, and potentially respiratory arrest. While other complications can occur, the suppression of the hypoxic drive is the most significant and well-known risk of uncontrolled oxygen in COPD. Therefore, oxygen should be titrated carefully to achieve target saturations, for example, 88 to 92%, without over-oxygenating.